Hi everyone, it's Sleeve Christine. I've been meaning to update a video for you guys. Today is Wednesday, December 7th. I want to let you guys know that I went for my introductory bariatric surgery program meeting last Friday, December 2nd. I went and I learned quite a bit of things that they have changed. I've gone to 2 other appointments in the past, and this time they gave new information. The packet wasn't really updated much. It's all still the same steps, still the same stuff that you have to do beforehand. They were just able to give you newer information that they have and more information. They've changed some stuff a little bit. So I went to that. One of the things I have to do is Friday I'll be seeing, well, not my doctor, but I'll be seeing a nurse practitioner in his office. My PCP, which is primary care provider, is no longer with my doctor's office. He switched and he is now 30 minutes away with actually the VA. So I guess I'm seeing the woman that is kind of like stepping in as an extra. She's always been with the doctor's office, but I believe she's just stepping in to be able to help who would have been his patients, because they cannot reassign me a different doctor for 3 months. So I'm going to be seeing her on Friday because she needs to record, or at least write down on there with the doctor's office letterhead, what my highest weight has been within the last 6 months and what my height is. That way I can mail that along with the sleep apnea worksheet they gave me and my health insurance sheet where I had to write down the number and all that. I have to send all those in. That way they know, okay, so I am starting the process. Because Friday, everybody had to fill out a piece of paper that said that they were there for the introductory meeting. Now this is like the next step, saying, okay, now I'm starting the process instead of just going to see what it's about. So I have to send all of that in, and then after that, I have to register with Remedy EHR, which is a site that they use, and it's linked to Just Dartmouth because that's where I'm going. It is linked. They somehow link it. I guess there's a drop-down box, and you have to click that you're going to Dartmouth. So you set it up, and that is how you're able to be in contact with the surgeon, with the nurse, with all the bariatric program staff that they have at Dartmouth. If you have questions, you can do it. You also document your weight. So if you lose weight, gain weight, anything, you put it in there. I believe you can also document your meals, but I can't quite remember. It's been a few years since I even set one up. And then they also have a kind of like a group forum that all of the bariatric patients that are starting out new and that have done it in the past, it's kind of like a support group on there for just people that have gone to Dartmouth. So that's pretty cool, because then you're talking to people that are in the same program. That way, because each program's different. So this helps in that way. So I'll be able to set that up once I send the paperwork on Friday. So I'll probably set it up like next Monday or Tuesday, because it takes about 1 to 2 days for mail to get there, and I can't mail it out until Friday. So that will give it time for them to get it so that they can create a file for me. And then on top of that, next week I have a lot of appointments between me, my youngest daughter, my oldest daughter, my son, all of it. So next week is pretty much jammed packed. Next Tuesday, I can say, because today's Wednesday. So Tuesday I go and I have my first psychological evaluation. I'm excited. I'm nervous. I've never met the guy before. It's the one that my nutritionist gave me, and it's the one that she always refers, her, I guess you can call it, her patients to, that does the psych evals if she knows that they're going for bariatric surgery. So I'm going to go and see him. I am nervous because I know a lot of people that have failed it. You have to have 2. I don't know if you have to pass both of them or what. I don't know. Hopefully he'll be able to answer those questions. If any of you guys know usually how the psych evals go, if you fail the first one, pass the second one, do they still take you? my program never said. It's just said that you have to have two psychological evaluations. So hopefully he can answer that, because he has worked with a lot of patients that have gone to the bariatric surgery program for Dartmouth, Fletcher Allen, which I think is now called like UVM Medical Center, and Albany Med in New York. I live in Vermont, so I'm going to New Hampshire. I could go to the UVM or Fletcher Allen, whichever you want to call it now. I could go there. I personally don't care for their program. Like they're not upfront about their information. At least to me, they weren't. I'm not bashing them in any way. They are still there to help people. But I personally find that for me, their program just wasn't for me. And Dartmouth is. So that's why I'm choosing to go to Dartmouth. So I'll be doing my first psychological evaluation on Tuesday. And then they said that my psychological evaluations have to be at least a month apart. So I have one in December. So January will be my next one. And those can be sent separate. I have a pretty much a booklet that tells me everything that I need sent. So Friday when I see the NP, the nurse practitioner, I can hand her this. It's almost like a letter that Dartmouth writes out. They write out a letter for your nutritionist telling them exactly how they want their kind of like notes written. And then another one that you give to your doctor that tells you the blood tests that you need, all the paperwork that they want them to give you to send in the packet. And then they also give one, they have one written up for the psychologist. So I'll be giving him that, even though he probably already has it. He probably has all these from all the different ones. I have to give it to him just in case. That way he can document it the way that they want it. I have to give my doctor's office, because my nutritionist is in my doctor's office. I have to give them the letter for the nutritionist, and hopefully she can work on that, because I have to send everything except for the psychologist's psychological evaluations. I have to send everything in the packet, and then they will tell me if I'm missing something, if my insurance wants something extra done. They'll let me know all of that, and then I can start working on seeing them and getting closer to my surgery day. After Friday, after she weighs me, she writes down my highest weight, all of that. That is when I am going to be starting to really start watching what I'm doing. I am going to go on a low carb, low calorie. Right now, I'm trying to stick under 1,700. After Friday, I'm going to try to stick under 1,200 calories. And no more than, they say no more than, I think it's either 110 or 120 carbs. I'm going to try to keep less than 80 carbs. I do have PCOS, so I am insulin resistant. I have to watch what I eat. Obviously, I mean, I already do, but I have to watch it more. Because I have PCOS, it's harder for me to lose weight, especially because I'm not on metformin currently. So my insulin level is higher than what it should be. Having PCOS is very, very frustrating. Plus, I have to stick to another type of diet because I have a history of kidney stones. So that's, all in all, it's very frustrating, because I have all these different ways that I have to eat. And then I found out, and then I heard that, after you have bariatric surgery, that you're more prone to kidney stones. I'm already prone to kidney stones as it is. So that means I've really got to up my intake. One of the women at the meeting brought up Isopure, and how she drinks it, and she gets, because, my bariatric program wants you to have at least a minimum of 80 grams of protein a day afterwards. So I also have to make sure I'm hitting that during the day. But she brought up Isopure because she has a hard time getting it all in. So she drinks half of her protein, because I guess she gets 40 milligrams from, or grams, yeah, whatever. She gets 40 of the protein a day just from the Isopure. I've heard mixed things. My friend that had the VSG last December 15th, she's almost to her 1-year surgery, which is awesome and exciting because I've seen her progress and she's doing amazing. She said that it was crappy. She hated it. It was disgusting, all that. I'm wondering what you guys think. Have you guys tried it? Are there any flavors that you guys like? Can you tell me? Because I don't. I'll probably buy, like, if I can buy one bottle. I think they come in like a pack of 12. So if anybody knows where I can just get one bottle, if you can let me know. I want to, you know, obviously everybody has different taste buds. I want to at least try it, see how it is and all that. But I don't want to waste money on 12 bottles if I don't like them. Because, I mean, a lot of people don't even know what it is. So, yeah, I mean, that's pretty much all that I have to update. I do know my highest weight is 290 pounds in the last 6 months. And that I'm 5'6". I'm excited to start really going through the process. I've started journaling my feelings, because you go through a lot, you know, you can come up with BDD and you have a whole body image and a lot of people go based upon the scale. I am going to have, you know, I'm going to weigh myself and everything, but if the scale doesn't define like how much you weigh, because a lot of people, they lose fat, but then they gain muscle. So it shows that they didn't lose anything. So I'm going to try to keep an open mind, try not to get down on myself. I mean, you're changing how you're going to eat and it's for the rest of your life. You have to decide why you're doing it. I'm doing it for myself. So I'm the healthiest for me. I'm the healthiest for my family, you know, plus I am trying to finish my nursing. So, you know, I want to be healthy that way too, because I don't want to be this overweight nurse that can't breathe, and has a hard time getting to her patients. I don't want to be that way. So, you know, I have a lot of things motivating me. Some people, it's not for them. And I'm not judging anybody. This is my personal choice. I have come to terms with it. I am looking forward to it and everything. So, I mean, that's pretty much my whole reason for doing it, is I'm doing it for me. Especially because diabetes runs huge in my family. So, you know, I've started the process again for the third time. I've started it. I'm going to get through it, and I am looking forward to going through the process and letting you guys know how my process went. And if you have any questions, you can, you know, comment under any of the videos. I believe YouTube, like notifies you if somebody's commented. I don't know. I haven't, really looked at those features, but yeah, you know, that's my update. I'll have another update on Friday, letting you know how that went. And then I'll update you guys on Tuesday also to let you know how my first psych eval went. So I hope you guys have a great week. Bye.